Hello, this is Dr. Rastetter from Pets and Stitches. I wanted to make this video as a way to educate our clients, potential clients, about some changes that have been going on in the veterinary community in the last few years, primarily associated with spaying and neutering. Most anybody who has owned a pet, taken their pet to the veterinarian, probably at one point had the veterinarian recommend that their pet be, the dog or cat typically, be spayed or neutered. The reasons for that are definitely valid. Mainly the big spay and neuter push started in the 1970s as a way to reduce pet overpopulation and also the mass number of euthanasias that were happening of dogs and cats because they couldn't find homes, or they were strays and causing local community problems. That has been one of the most successful things that we as pet owners and veterinary professionals have done to reduce that rate of euthanasia. There's other medical reasons to do so too. I'm going to focus on dogs in this talk though. The female dogs, if they are not spayed by the age of 10, 25% of them will experience an infection of the uterus that can be life-threatening, and that is called pyometra. People that find themselves with dogs in that situation, they are usually faced with thousands of dollars in veterinary bills with even no guaranteed outcome that their pet will survive. And I've definitely seen many of those in my career. You know, when I trained at Ohio State University, and I graduated in 1998, it was spay and neuter, spay and neuter, spay and neuter, especially spay and neuter by 6 months of age. And over my 2+ decades of career, that is still very much a recommendation that is touted heavily. I've seen things about spay and neuter by 4 months of age to try to guarantee that we are not going to have a dog that reproduces by accident, leaving room for variation, such as you have an appointment scheduled at 4 months, something happens, you have to reschedule, you still got time, rather than scheduling it at 6 months and then you have to reschedule and then they come and eat and get pregnant. Lots of good reasons behind some of those campaigns that I've seen in my career. And I drank the Kool-Aid, promoted spay and neuter everywhere, even worked at a low cost spay and neuter nonprofit program, Siska, which is one of our local adoption facilities, routinely spaying and neutering dogs that were even as young as 6 or 7 weeks of age. And I know that I did a lot of good. I prevented a lot of disease. I also prevented contributing to the pet overpopulation problem. Over that time, though, it would be interesting because I would meet people, pet owners sometimes, that would be very adamant about not spaying and neutering their pets. They would mention concerns about altering the biological makeup of a dog, about what effects that the neutering could have or spaying could have long term. And I'll be honest, I pretty much poo-pooed them. I kind of, said, they don't know what they're talking about. And they actually had a point, and we are learning that. In the last decade, there has been research that has been done primarily by University of California, Davis, 3 studies out of there, and also 2 studies out of Sweden. And those studies, the ones at University of California, Davis, were focused on golden retrievers, one of the most popular breeds there are, also one of the breeds that has some of the most medical problems, also German Shepherd dogs, which tend to have horrendous issues with hip dysplasia, where the hips are not formed correctly and thus they end up getting arthritis or other issues. and also Labrador Retrievers. Labrador Retrievers, again, orthopedic issues, a lot of ACL tears, hip dysplasia. So University of California, Davis did some studies, and what they were showing is that spaying and neutering can actually, in these dogs, increase the risk for certain cancers and orthopedic problems later in life, especially if spayed or neutered before 1 year of age. The study in Sweden, 2 studies, were Rottweilers. Rottweilers, sweet dogs, usually if trained well, have a horrible reputation for getting osteosarcoma, which is bone cancer. Unfortunately, in many cases, by the time a veterinarian diagnoses the bone cancer, it has already spread. And many times we do amputate either because we can't identify that it's already spread and later they showed up in other areas, or we are amputating a leg, putting them through a major surgery that as a pain relief, palliative gesture to try to give them pain relief for the remainder of their lives. So these are some very serious things that are happening with these breeds. And the study in Sweden said that neutering increases the risk for osteosarcoma. It also, in the Rottweilers, decreases the life expectancy. There are some design flaws with the Swedish study, but it does tie into some human studies too that looked at similar issues. Interesting enough, in 2014, there's a lesser known breed called Vizslas, and they did a study and they showed that there is an increased risk for fear behavior and also fear of storms, basically, and also cancers in Vizslas if they are spayed or neutered. So I started hearing a little bit about some of these, and then I also met another veterinarian who educated me more about orthopedics, orthopedic development. And she was very much a proponent. She opened the doors for me about that maybe that 6 months spay or neuter guideline is not appropriate because on average, the last growth plate closes at 14 months of age for a dog. So you'll hear more people maybe say spay and neuter at 1.5, 2 years of age, and there's some basis for that too. And even these studies show that if you spay and neuter those particular breeds, the golden retrievers, the Labradors, the German Shepherd dogs, before 1 year of age, that's where you'll see the most increase in some of those long-term problems. So my mind started being opened, and I started noticing the clients more that were expressing the concerns. So I spent a couple months where I pulled over 50 scientific journals, not only the ones that I mentioned, but also some other ones. Did a lot of digging, a lot of reading. And I came out of that also having learned about some alternative procedures for spays and neuters. And I became a proponent for not applying a cookie cutter solution to every dog. That there needs to be some individual variation. The breed needs to be taken into consideration. The size of a dog with the mixed breeds needs to be taken into consideration. The owner's lifestyle and what they can do, what they want, that needs to be taken into consideration. When I started looking at all this, it was obvious to me there's no definite solution. So I had become aware about the possibility of doing an ovary sparing spay and a vasectomy. And some of you may say, well, why do that? You could just either, again, wait till they're 1.5, 2 years of age and spay or neuter, or you can just not spay or neuter them at all. Because pet overpopulation can easily come back. Things happen. People, unfortunately, sometimes their lives are such that they can't always prevent a pregnancy from happening, whether it be that they have male and female dogs in the house, or they have kids that are running in and out of the house, and so the dog gets out and gets pregnant or causes a pregnancy. So that still has to be on the radar, a big concern. We want to prevent the pregnancy. We want to prevent the infections of the uterus, the pyometra, because 25% of dogs by the age of 10 will get that. And I've seen a lot of them. I've seen dogs die from it. I've seen dogs live, the majority of them do, with treatment, again, and it's expensive. We have been offering ovary sparing spays and vasectomies now for 4 years. Last year, we did 21 ovary sparing spays and 19 vasectomies. That was 2019. And I am so excited to see more people choosing this route. Those clients that call us, if you tell us that you have one of the breeds that is part of the studies that have been done, we will definitely be mentioning the ovary sparing spays and vasectomies to you. And also, if you're not interested in that, potentially waiting longer to do the traditional spay and neuter. So that way your pet has a better chance of not developing some problems that could be prevented. Please feel free to reach out to us through our website or through the comments below if you have any questions. I will put in the description a link to our website that has more information about the studies that I've mentioned, other experiences, and also a Facebook group that focuses on ovary sparing spays and vasectomies. And I'm really hoping that 2020 will see us do even more ovary sparing spays and vasectomies. Some orthopedic surgeons I've been talking with are supportive of it too. The American Veterinary Medical Association is also supportive. And this is something that I truly believe that we will be seeing more and more in our pet dogs. And have a good day. We'll see you when you come to Pets and Stitches.